Good afternoon. I'm Lee Brandstetter. As a member of the Committee on the Security of America's Medical Product Supply Chain, I would like to welcome everyone, especially our guest presenters. I want to note that this is an open, on-the-record information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the academies. For those of you not familiar with the committee process, this is a committee information gathering session. Some of the committee's meetings include public sessions where we have the opportunity to hear from many experts in the field and receive public testimony. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee must then respond to this review with appropriate revisions that adequately satisfy the Academy's report review committee and the chair of the National Research Council before it is considered an NRC report. The expected report release is the first quarter of 2022. Further information on the study, including future meetings, can be found on the project website. This committee is being asked to first assess and evaluate the dependence of the United States, including the private commercial sector, states, and the federal government on critical drugs and devices that are sourced or manufactured outside of the United States. And two, provide recommendations to improve the resilience of the supply chain for critical drugs and devices and address supply vulnerabilities or potential disruptions of such products that would significantly affect or pose a threat to public health security or national security. Today, this public session will focus on trade policy issues to improve the resilience of the medical product supply chain. In the interest of time, we're going to be very brief in our introduction of speakers. We'll just introduce them by name, title, and affiliation. During the question and answer session, only the committee will be able to ask questions and provide comments. And this is to ensure adequate time for discussion with the committee. So we'll now get
recording
started
in progress
with our first panel session. It's my pleasure to introduce the first speaker, Monica Gorman, Deputy Assistant Secretary of Manufacturing, Industry and Analysis in the International Trade Administration at the U.S. Department of Commerce. Each panelist is going to have 7 to 10 minutes for a presentation. We can allow the committee to ask clarifying questions immediately following each presentation, and then we're going to move to a broader panel discussion. Ms. Gorman will be followed by Carter Wilbur, an economic officer in the Office of Multilateral Trade Affairs at the U.S. Department of State. So thank you both. Ms. Gorman, the floor is yours.